Ever pondered the difference between carpal tunnel syndrome and Lacertus syndrome? These two conditions both involve the compression of the median nerve, but the similarities largely end there. In the case of carpal tunnel syndrome, the median nerve experiences pressure at the wrist within the carpal tunnel, a narrow passage made up of bones and ligaments. This can lead to numbness, tingling, and pain in the thumb, index finger, middle finger, and half of the ring finger. Hand weakness is also a common symptom. This discomfort often intensifies at night due to fluid buildup in the wrist canal. On the other hand, Lacertus syndrome involves the compression of the median nerve in the forearm just below the elbow by the Lacertus fibrosus, a thick band of tissue. The primary symptom here is pain in the forearm, along with potential weakness in grasping objects. Numbness and tingling may occur in the same fingers as in carpal tunnel syndrome, but the symptoms usually do not worsen at night. Diagnosing these conditions involves a physical exam and a patient's medical history. Doctors may also use electrodiagnostic studies, which measure nerve conduction to confirm a diagnosis. However, these tests aren't always conclusive for Lacertus syndrome. The treatment for both conditions can involve a variety of approaches. These can include using a splint to rest the wrist or forearm, modifying activities to avoid those that exacerbate the symptoms, taking anti-inflammatory medications to reduce inflammation, and undertaking physical therapy to improve hand and wrist function. In severe cases, surgery may be necessary to release the compressed nerve. It's important to note that carpal tunnel syndrome is significantly more common than Lacertus syndrome. Additionally, due to overlapping symptoms, Lacertus syndrome can sometimes be mistaken for carpal tunnel syndrome. So, if you're experiencing symptoms that might suggest either carpal tunnel syndrome or Lacertus syndrome, do not hesitate to seek medical advice. A proper diagnosis and treatment plan are crucial steps towards recovery. Remember, while these conditions may seem similar, they are distinct in their location of compression, the typical symptoms they present, and the ways they are diagnosed and treated. Understanding these differences can help you navigate your health more effectively.